There are many different types of arthritis of large joints like the hip. The most common ones that we see in the office are osteoarthritis. That would be the most common one. Osteoarthritis is a wear and tear condition of the joint. So it's primarily when we consider a joint that's seen a lot of use and a lot of wear, and it wears out over time. That would be osteoarthritis, and that's the majority of the patients that we see with hip arthritis fall under that category. Other common causes of arthritis are inflammatory arthritis. We call them inflammatory arthritis. Many people are familiar with the terms like rheumatoid arthritis. That would be the most common of the inflammatory arthritis. But there's a variety of different types of arthritis that fall into that category, including things like psoriatic arthritis and things like that. But those are more of a condition of the joint where the symptoms are similar, the pain is similar, but rather than just pure wear and tear on the joint, there's actually a condition of the body that's somewhat mediated by our immune system that causes that joint to become inflamed, painful, and over time, if not treated, can be worn out. I would say the third most common hip arthritis that I see in the office is what we call post-traumatic arthritis. Post-traumatic means after trauma or injury. So some sort of injury that happened before to the hip, that can sometimes be a broken bone, like a broken hip or a broken hip socket, or a torn cartilage labrum of the hip. When those types of injuries occur, sometimes years later, that can lead to wear and tear on the joint. And so that is a fairly common cause of arthritis of the joint. And I would say then probably the last, if I'm thinking about maybe the top 4 causes, the last one that I see is a condition called AVN of the hip. That's an acronym that stands for avascular necrosis. Avascular means without blood supply. Necrosis means death of the bone. And so you can actually have some decaying of the bone where the bone is sort of wearing out from the inside out versus osteoarthritis where it kind of wears on the surface. This is more decaying of the bone from the inside, and there are a whole bunch of conditions that are rare but that can cause this situation with the joint that cause it to wear out prematurely.